Are stepping up efforts to remind all of us to protect ourselves, and they're joining now to explain how they're joining together is medical reporter Liz Bonis. Liz.
And good afternoon, Paula. It started with just a few cases traced back to Disneyland from a family that had not received vaccinations. It has spread from there across the country, and now reports today from the Centers for Disease Control and Prevention say at least 84 cases of measles in 14 states have been confirmed in just the last month. Now, infection control experts say that at one point we actually had wiped out this virus, and what's happened is that families have opted out from what they call the MMR, the Measles, Mumps, or Rubella vaccine. It has returned, and if you've not had the vaccine, that means you or your children are at risk of getting this virus. We talked to the head of TriHealth's infection control expert today. He is Dr. Blatt. He says this is so contagious that if you get exposed to this virus, you're just simply likely to get it if you haven't had the vaccine.
Well, you inhale the virus, so if somebody's been in the area and has measles, it's highly contagious. It's one of the most contagious viruses we know of. The virus can be spread through the air by a person coughing who has the disease, and it can be spread even before a person has the rash due to measles.
Now, before the vaccine, about 400 people a year would die from this virus. Coming up at 6, what we asked is, we've been hearing this controversy with politicians weighing in, saying it's choice versus the public good. Yep. And when you talk to experts, they say, there's a difference in choice. You can't starve your children. You know what I mean? You can't. Right. There are certain things you cannot do, and science definitely supports getting this vaccine. So we're going to share a little bit more on that controversy.
Adults and children?
Adults and children, and adult can get it at any age, meaning you can get the vaccine at any age. Some adults don't know if they've had it, so you have to go back, and usually your family physician can go back and start checking your records and see if that's been reported throughout your lifetime. We're going to talk to a woman at 6 who said she knew her kids had had it. She didn't know if she did, and she's doing the same thing.
I think we're all going to start checking right now.
Yes, absolutely. Yeah, I know I had it, but I had a good mom. She was a nurse and kept track of that stuff. But some of us get lucky.
What do you have coming up?